Good evening to all, and welcome to Mental Health First Aid India in the session that we have built together for mapping Tele-MANAS. Mental Health First Aid India is licensed by Mental Health First Aid International, and our mission is to build literacy among public in mental health and as well resolve stigma or address stigma along with other initiatives that are there across the country. Let's go ahead. So today's session is very special. Today for a long time, I was keen to have with me a representative or members who are working with one of the most innovative and the most, well-built program called Tele-MANAS. And thank you to its members. Today we have the opportunity to run a session and to understand more about it. What we'll be talking about. So like we had announced before, I had invited Dr. Naveen Kumar, and he is the principal investigators at the Tele-MANAS support center at NIMHANS. Unfortunately, Dr. Naveen is caught up with an official meeting, but he has promised us to join. Instead, we are very grateful to have here a colleague of Dr. Naveen Kumar, Dr. Swati Ravindran. She is Assistant Professor of Psychiatry at the Apex Coordination Center for Tele-MANAS at NIMHANS. So, Dr. Swati, welcome. Thank you so much for joining us at a short notice.
Thank you so much, ma'am.
Yeah, how are you today?
I'm doing well. Thank you. It's been a great day actually so far.
Awesome. That's lovely. Good. So let us go ahead and in hope that Dr. Naveen will be able to join us. We'll be moving ahead. I'd like to thank you, everyone who has joined, who was interested to listen and to be part of understanding more about Tele-MANAS. Now, why I was interested to have this session. As a Mental Health First Aid India, we come across a lot of corporates and people. We try to educate them in mental health, and you can't be a good first aiders unless you understand what are the services that are around you. And we are definitely very dedicated promoter of public services. It's very important that public services get used, are accessible, and when we do the training and we inform about services like Tele-MANAS or health centers and anything else that is out there for access to services, we see that there is a bit of low understanding or low knowledge around it. So this is the spark. I have met Dr. Naveen earlier in other events, and I was amazed by the work done around Tele-MANAS and the achievement that Tele-MANAS had. So this session is dedicated to all our people that we have worked with, to public, especially to corporates that we work extensively to understand more about Tele-MANAS, but as well to see how these services can be accessed and utilized more and more. So Dr. Swati will help us with this understanding and knowledge. So Swati, Dr. Swati, my first question to you is, what is Tele-MANAS? If you can just wrap up in a brief note about it, would be grateful.
Yes, ma'am. So thank you for the opportunity, and it's indeed an honor to be invited and be part of this live stream today. So Tele-MANAS stands for the National Tele-Mental Health Program of India, and it is the digital arm of the National Mental Health Program of India. It's an extension of the same. So basically what it is, it's a comprehensive digital platform. We operate through a toll-free number, 14416, and we are a 24/7 telemental health facility, which is a tire-based system. We operate through 53 Tele-MANAS cells across India, and we have around 600 counselors who are distributed in these cells across India. And each of these cells have, say, 10 to 20 counselors, and we also have tire-based support. So Tele-MANAS is basically, for people's understanding, it's not just a helpline. We have a tire-based platform, so it's more comprehensive than just a helpline. We have this aim of setting up Tele-MANAS itself was to have a universal, equitable, accessible, affordable mental health care. And that's how it came into being. And while also providing this tier-based support, ensuring access to specialists, video consultations, e-prescriptions, and lastly, to also be inclusive of the vulnerable populations of our country. So that, in brief, is the aim and objective of this program. And
Excellent.
yes.
Thank you. Thank you so much, Dr. Swati. So I would go further, and for the audience, we have placed in chat the Tele-MANAS website, and I hope my team as well has put the Tele-MANAS app, and of course the number is there. So whoever would like to take note, please, because you can keep it handy in helping people around you, and it's absolutely very important. So going forward, Dr. Swati, so I remember when the union government introduced the budget 22-23, and in that, this was somewhere in February 2022. And the Minister of Finance introduced under Ayushman Bharat Digital Mission a few schemes, and among those were two that were more prominent in the digital aspect was the budget allocated for the National Digital Health Ecosystem, which is a mega project, is huge, and I know that the work is going on intensively on that, and Tele-MANAS. So Tele-MANAS was on response definitely to, like you said, access to care, assuring quality, and of course responding to the very increased need after COVID 2019, isn't it? Now, it was announced in 2022 February, and it was launched in October 2022. Now, I'm very curious to know what was the driving force to the team to build Tele-MANAS in just 7 months. Would have been a great experience being there, trying to assure accessibility, to assure quality, to assure a network, and to keep up to the promise the government gave. How was that? What was the driving force, and how was that experience?
So initially, ma'am, when we started Tele-MANAS, it was built from the learnings of the COVID pandemic. The pandemic it brought about so many things, there was devastation, there was loss, there was a mental health pandemic, we say the silent mental health pandemic, which was also ongoing. And that really what it did for India, specifically, I think, was shed light on the mental health needs of us as a nation. So that's pretty much how Tele-MANAS came into being, and why it was announced in the budget was because there was a uniform consensus among our policymakers, among our mental health professionals, saying that there is a need for a digital mental health program so that we can have access to mental health professionals from the comfort of our homes. So that's how it was announced, and it was in the aftermath of the pandemic and the learnings. I'd like to mention here that during that time, NIMHANS had set up, under the support of the Ministry of Health and Family Welfare, of course, the National Psychosocial Support Helpline, which was actually only for psychosocial support in light of the COVID pandemic. We started on March
I remember that.
1st, 2020. I was a senior resident at the time, and we received 6 lakh calls. And it's a very candid confession, but I think it gave us a first-hand experience of, we were the first handlers of those phones, and we were the first-hand counselors to take those calls. And it really told us the scope of just how pervasive mental health is, how much it sort of permeates into every sphere, every domain of life. So even individuals who previously did not recognize or would scoff at mental health issues suddenly came into the ambit of mental health. So it was based off of those learnings that we started to build Tele-MANAS as a program. And we realized that it had to be decentralized. So the ministry was extremely supportive, and there was a national technical advisory group which was set up by the Ministry of Health and Family Welfare, which had 3 technical subcommittees: one for health service domain, one for technical domain, one for health resources domain. So this is NIMHANS, IIIT Bangalore, and the NHSRC, which is in Delhi. And
Mm-hmm.
all three have sort of worked together since the very beginning so as to build this platform. So
Mm-hmm.
everything what happened in those 8 months, to be specific, was building up of a platform from scratch,
Yeah.
making sure that there is a place where the counselors can enter information. We are
Mhm.
doing justice to the callers, at the same time
Yes.
anticipating what kind of calls may come, making a data sheet according to that, and of course training of our counselors. So training has
Yes.
really been the backbone. Initially it was a 3-day online training, then we built the on-site component, we launched 3 manuals. So there's a ready reckoner, which we call the course content manual, which is theoretical. There is a point of care manual, which is more like
Mm-hmm.
flow charts and how to handle each case with case scenario
Mm-hmm.
examples. And there's a trainer's manual. So these 3 manuals
Mm-hmm.
were also prepared at record speed at the time. And
Yeah, I
we
can't even
started on time.
imagine the energy and the coordination put forth to have Tele-MANAS ready on 10th of October 2022. Amazing job. Heads off to you all contributing to this. But yeah, like you, interestingly, that experience of NIMHANS during COVID sort of, I guess, told you the magnitude of the needs that was
Yes,
at that hour and how that needed to be streamlined, formalized, and made it much more structured. Thanks a lot for the work you all do on mental health and responding to such a very needed time.
thank you.
So going forward, I wanted to bring another point here. I want to refer to Mental Health Care 2017, the Act. Okay, and under Chapter 5, definitely we have the rights of person with mental illness, and we definitely have in point 18 those rights in access to mental health, isn't it? So one point that is very specific to that, she says point D.
Hmm.
It says that the government should ensure that everyone has access to care. It doesn't matter the age, and they should not travel long to access that care, isn't
Absolutely.
it? And we all
Yes.
know that despite there is a lot of effort put from the government to work with health centers, sub-health centers, yet there
Yes.
are places where health services is not accessible. My question to you is Telemanas bridging that gap? Please share with us some statistics that can tell us the reach from 2022 so far.
All right. So this is what you mentioned. It's an outcome that will, I think, always be our goal as to whether we can reach every last Indian. And that's when
Mm,
I think we can finally say that, okay, we have ensured access.
yeah.
However, that said, from the word go, that has always been a process. And the center of us building this was that we should ensure accessibility to all. We have currently reached, we're almost at 3 years now,
Yeah.
so we've crossed 2.7 million calls across India. And
Mm-hmm.
that number also, I think the first year it was around 1 lakh. We just crossed, I think, around 1 lakh. And what we've seen is like a meteoric rise with
Mm-hmm.
regard to the number of people reaching out to the
Okay.
service. And that it varies a lot depending on how, on people getting to know about the service. So like you said,
Yeah.
people knowing about the service itself is where one of the the points which we need to work on a lot more. But then once they know about the service, and once they know that this is something they can reach out to, many people reach out over and over again. Like I think
Oh.
a good
Mm-hmm.
4/5 of our calls are also people who call repeatedly, not just once. It's not a one
Amazing.
time
Mm-hmm.
intervention. We've also seen that most of the calls are, handled by the counselors. That was another premise that we'd set up Tele-MANAS on. The
Mm-hmm.
fact that not everybody who is in India, a citizen does not suffer from mental illness. That's also what we saw
Of course.
with the National Mental Health Survey 2016. And
Yes.
what we're finding in Telemanas is also very similar to that. The calls that require
Mm-hmm.
escalations are also, say, 10% or so. The rest are all handled or are being, are capable of being handled at the
Initial
counselor
basis.
level. They are
Yeah.
regarding mental distress, or they may be regarding
Mm-hmm.
support, interim support for the temporary
Mm-hmm.
distress in one's life.
Mm-hmm.
Um, we also ensure that we don't exclude any age group, any gender, any group when we are talking about Tele-MANAS, because Tele-MANAS truly belongs to the people. It is a national
It
mental
should
health
be that
program for
way.
the people. Yes, it's for all age groups. We are inclusive with regard to all ages, all genders. Everybody who wishes to reach out to the service
Mhm.
absolutely deserves to have access. So what we're seeing also is that the male female ratio is almost stabilized at like 45 to 52. It's almost remained the same. So the number of males and females reaching out, it was surprising for
Very
us a little
interesting.
bit. Yes, that
Yeah.
it's a slightly more males, but it's almost remained consistent through these 3 years.
Mhm.
Most of the people reaching out are the general adults, but I think that also has to do with the fact that who has access to technology, who has access to
Yes.
social media, who has access to a phone. So I think those are
Mm.
also things which influence
Important.
people, yes, people reaching out to Telemanas.
Mm. That's amazing work to see as well how um, whatever data are there is sort of validating through, I mean, access to care. And what I see through Telemanas, and that's exactly my next point to this. So what we see is that in our country, access to care, to healthcare is mainly private. But with that, we need to acknowledge that it's expensive. Out-of-pocket expenditures are more than 60%, and this is healthcare. In
Mm.
mental health, definitely it will be much larger, isn't it?
Yeah.
So what we see, me living here for 15 years, I mean, accessing healthcare for myself, for my family, meeting thousands of people across India all these 8 years, working with mental health first aid. And when questioning, like, why don't you access public service? There are many reasons. We don't know where it is. There is a belief on, there is a concern with quality, there is a concern whether they will take the same outcome. There are multiple things that become or are barriers towards accessing public services. But it's so crucial to accessing public service because personally, I believe if you don't use the service, it will never improve, will never get better. So it's we as citizens that need to reach out. Now, what I would like to come, where I would like to come is that Telemanas as a model
Mm.
mm, can help rebuild the trust to public services, isn't it? So address all these questions that people have, like, is it quality? Will it help?
Yes.
Is it accessible? And so I feel like I think that Telemanas is sort of democratizing access to services, to public health services, but as well is helping to rebuild that, among other, I mean, benefits that is given to
Mm.
public.
Mm.
So, just to enhance, Dr. Swati, this part of building trust, what is the rigor behind Telemanas? The rigor of protocols, training, people that are, like you said, right, the counselors are there, and you had to develop as well 3 manuals, training. So what is the rigor behind here, behind Telemanas, in order to assure that high quality? And it tells by itself that you're saying that people call more than once. That tells a lot. So just for public to know what it takes to be staff of Telemanas, to be able to respond and to provide a satisfactory and supportive help to people that really are calling because they feel they'll be helped.
Yes. Thank you for that question. It's actually it's been a learning curve for me as a mental health professional as well. Even after having finished my MD in senior residency in a hospital as
Mhm.
big as NIMHANS, it was still a completely new experience for us to
Mhm.
build a national program from scratch. There were things that we understood only, like you said. I like that you brought out that point that people using the service, they are the ones who have taught us so much, and the program is pretty much built with that.
On them,
So
yeah.
it has been built with the nature of calls coming in. It has been built with the kind of challenges that we faced as we learned. So
Mhm.
every call has, in a sense, been a teaching experience for us.
Yeah.
How we were at say 50,000 was not how we were at 5 lakhs, was not how we
Mhm.
were at 15 lakhs, and definitely now
Mhm.
how we are now. And it has all been because of the efforts, I would say, not just efforts of the counselors, of course, the backbone of our program, and also the callers who've, really reached out over and over again. They would highlight some issues. So we often watch out for roles, reviews, how are we, what are the kind of feedbacks we're getting, feedbacks from the counselors. So that is the premise for us to keep building on, and it'll be a continuous process. That said, I think the program itself, I think there was a really strong push from the government, and the structure, it is probably one of the very well structured programs right from the outset. So all that hard work that went in the beginning from all the stakeholders involved, whether it be the Ministry of Health and Family Welfare, NIMHANS, IIITB, all the states, so 36 states and union territories coming on board, mentoring institutes. So I'd maybe just take a moment to tell you about the structure of Tele-MANAS
Yeah,
here. So it's
please.
we have the Apex Coordinating Center, which is NIMHANS, which also has under it these centers of excellence, or mentoring institutes, what we call. And these mentoring institutes are 23 in number. They are spread across India. We have 5 regional coordinating centers for each north, south, east, west center. And at the base of all this is the 53 Tele-MANAS cells. These cells, there are 1 to 4 Tele-MANAS cells in every state and UT of India. And depending on the size of the state, they were already sanctioned by the government, ensuring
Right.
that that accessibility. So this is even divided as per telecom circles, just to ensure that every last mile is covered by
It's covered.
Tele-MANAS. And we also have a dedicated cell for the armed forces, because those may not be issues which could be, helped
More
by
sensitive.
civilians. So yes, so and they're more sensitive, like you said. So there's an entire pathway which is developed for them. There's also an additional cell which was helped with a public-private partnership between 𝗦𝗽𝗲𝗸𝗏 and the government of India. So there are 53 Tele-MANAS cells across India, and in each of these there are counselors. There are 10 to 20 counselors, like I mentioned, in these stationed at these cells. These cells function 24/7, and they are in a shift job, so they'll always be on call. So there's a morning, afternoon, and a night shift. And the idea is to provide a more end-to-end care, not just counseling. So cases that require escalation, the cases we've trained our counselors through this. There's a robust training methodology. There's not just online training, there's on-site training. There is also this learning management system platform and accreditation of our counselors, which takes place. And through this process, the counselors are trained to recognize what cases they can handle at their level, what they must absolutely escalate. The calls which are escalated can either be handled at an audio call level, or they can even be converted to a video call by mental health
Okay.
professionals. And psychiatrists in Tele-MANAS can also prescribe medications. So in essence, you get a PDF of your prescription on your phone as soon as the consultation is over.
Finished.
And though we may not have been able to reduce all out-of-pocket expenditures, I understand the OP in India is around 50%, and it's one of the highest in the world. And especially when you said mental health care, it's even more. But we can take away some components. So loss of pay, the individual going to the hospital, travel, food, all
Traveling.
those can be cut. We may not be able to cut across medication charges, but the rest, definitely through Tele-MANAS, it can play a role.
Yes, that's and thanks for detailing it. Definitely, there are multiple benefits. Like I said, Tele-MANAS model I think is benefiting public at different levels. It is cutting costs. It's definitely giving immediate access. Of course, limited to whoever has a phone or access to and knows the number. But at the same time, is especially in crisis, is a life question access. So it's so important to save a life. But yeah, that's amazing. So it started with 23 and now is in more than 50. There are more than 50 centers of
53,
Tele-MANAS
yes.
across, 53 centers across.
53.
So, for my understanding as well, maybe to making it clear for public, when you say a person calls and a counselor is the first person that respond to the call and is a phone call, isn't it? When there
Yeah.
is a need for referring and sending it further, are those referrals to public services, like we said, health centers, sub-health centers, or those are professionals like psychiatrists or therapists who are hired and are part of Tele-MANAS team?
Yes. So both those components are true.
Mhm.
The first line of service is provided by the counselors. The
Yes.
counselors are also stationed with hired, recruited psychiatrists, clinical psychologists, or psychiatric social workers or psychiatric nurses, all
Mm-hmm.
of whom are present in these 53 Tele-MANAS cells.
I
The
see.
number of mental health professionals may vary across cells, but whenever now say for example, I have called a Telemana cell where there is no psychiatrist. So we have linkages, but that's where those centers of excellence, the mentoring
Comes into
institutes
the
that I
fund.
mentioned, they come in. So they can take those call escalations. So there
Mm-hmm.
is a plan B, there's a plan C even. And there may
Absolutely.
be, yes, ma'am, there may be situations where psychiatric conditions are such that you cannot handle it over video consultation or even
Yes.
a teleconsultation. It's not allowed as per the law. In those cases, we have what we call in-person referrals. As
Mm-hmm.
best as possible, we try to send them in a way that we would have, we would have contact. So, for example, if I refer them to NIMHANS, if it's an emergency, I can call the NIMHANS emergency team and tell them that this person is coming, or there is an
Okay.
individual which is expected who may be in a psychiatric emergency, thereby linking. So there is a I'm not putting the burden on the person to narrate their whole story again or say that just go to a
Mm-hmm.
hospital for the very first time with nobody to walk them through the entire process. I am also there with them. So we ensure that the counselor can stay on call with them whilst also connecting back end to
To
that
the
public health
profession.
service. Yes.
Yeah, so thank you so much for informing that and sharing that. But I travel quite a bit in Bangalore. I think like anyone who is working in mental health, and when we train and we say like, okay, when it comes to public health service, like, okay, we are lucky we have NIMHANS here. So
Yeah.
how about services that are, I mean, the needs when services are far, are in another state that is not Bangalore. Does it apply the same?
So I think that's where the role. So two things there, ma'am. In states, health is a state subject in India. I think demands would not. It's a very ideal model in that sense. Bangalore having demands, but in all other states also, in many other states, that's why Telemannas being the digital arm of the DMHP has been quite helpful. In
BMHP,
that we
yes.
are not separate from the DMHP. So when these in-person referrals are required, referring them to the DMHP or to a government hospital becomes very easy
Very
for us,
important.
for Telemanas professionals.
Awesome.
At the same
Mhm.
time, some states have also had home visits. So that's something
Mhm.
which happens in Karnataka quite often.
Yeah,
But in other states as well, wherein people have not been able to reach a mental health service, so they
Mhm.
have been, the DMHP has visited them instead. That's
Yeah.
only been possible because of this sort of structure which
Dischargement.
exists. Yes.
Yeah, for the audience, we have already done a live session talking about district mental health program, just to inform what the MHP is. District mental health program, which is across the country, and they are usually sitting in the tertiary care, but very outreaching, responsible for mental health care services promotion in the state. And to all mental health first aiders, they know they have a good list of all the MHPs that are across the country. But it's a very strong arm and very important arm of mental health care and access when it comes to under the National Health Program. Yeah, thank you for that. So I would like to come to another point. Again, referring to Mental Health Care Act 2017. And all these questions, I mean, have the purpose of definitely informing public, but at the same time, building that confidence. And coming from you, working directly, being there from beginning is absolutely the greatest opportunity for everyone to understand the value that Telemanas adds to access to care. So under point 23, of course, in chapter 5 because we are looking at the rights of people in access to care. Point 23 speaks about confidentiality. And Dr. Swati, you will agree with me thoroughly that one of the concerns that people don't reach out has to do with, is my story going to become the story of the office, of the town, of the neighborhood, of my family, and so on? That's the confidentiality behind sharing is one of the concerns, across with other being judged and stigma and other things. So point 23 under chapter 5 in Mental Health Care Act speak about confidentiality, where everyone has the right to confidentiality about their mental health, about their mental health status, about their care or mental illness, and anything revolving around health. How Tele-MANAS is assuring that when someone is calling, let us know whether they need to give their details. Like you spoke now a bit earlier about referral. Do they need to give their details? How much details do they need to give? And how these data are assured to be kept safe and to assure that people are confident that whatever is shared is kept safe?
Yes, ma'am. Thank you for that question. Again, very, very important aspect, especially when it comes to mental health. I think one of the first things I realized as a mental health professional is how different it is from being a doctor, right? Because it's one of the only fields wherein you also have the right over curtailing somebody else's rights. So I
Yes.
think that was the first things that struck me as very unique about mental health, and how there's a potential for misuse there as well, and why we must be very careful. Mental health is one of the only, I think one of the only fields which has its own act, the Mental Health Care Act 2017. So in this regard, Tele-MANAS, I'd like to inform everybody here, even people who would have never heard of the service, that Tele-MANAS does not record your calls. Okay, so your calls are not audio recorded. What we do have is a system to ensure follow-up care. So we have a data sheet that we have. So it's a case sheet format, basically, for the counselor to take details, to document whatever mental health struggles that you may be suffering from, and to also write the intervention that they may have provided you, a counseling intervention. And the same, like a more basic medical record format exists for the doctors and for the mental health professionals of Tele-MANAS. So in that sheet, we have some demographic details. So name, age, gender. At the outset, I'd like to tell you that the phone number is one unique identifier of an individual calling Tele-MANAS. It's not a unique identifier in that one phone number may be used to call anybody, any number of people. But we have a unique ID, a Tele-MANAS ID, which is unique to the specific individual. We never see your phone number. Nobody, neither the counselors nor us, nor anyone without proper authorization sees your phone number. So it is a masked ID that appears. With regard to your demographic details, do you have to give your details? No, you do not have to give your details. So with each of these columns, we have a prefer not to say. So if somebody is worried about, even despite of, all these clauses that we have, that all this data is stored in servers, NIMHANS is the data fiduciary, the Ministry of Health is the data fiduciary. We have a data privacy policy in place. It is very much in line with the DPDP, IT Act, MHCA, telemedicine, telepsychiatry guidelines. But still, I do not want to, say that I'm Swati calling. Say now, for example, say I'm calling. I work at Tele-MANAS, and I don't want people to know that I'm reaching out to Tele-MANAS for help. So I can go ahead with the care provided to me without my name or where I live or all those details, or even my gender being revealed. I can just say I do not wish to disclose that.
Yes.
The only rider on this, and like all laws, confidentiality is not also exclusive, in that if there is, the only rider to that is risk to life. So if there is a risk to life of the individual, in a case where somebody is suicidal, and
Yes.
they are suicidal, they are at acute risk, we get a lot of those calls as well, wherein there is an acute abrupt risk. The person is calling us at the moment that they're also planning to end their life. In that moment, my priority is not your confidentiality, it's your safety. So I
Safety.
would be ensuring that I would try all the methods possible. We do try verbal de-escalation. We always, always, always prioritize cooperation with the person as best as possible, as best as reasonable. Because
Yes.
in such situations which are very tricky, I think time is something which is very crucial. So
Yes.
if, for example, the phone gets disconnected or the person chooses to switch off their
Too
phone,
close. Yes, the
yes.
phone.
So in those, there also there is an SOP of how to unmask the number, who can unmask the number, who does that number go to, in what format, what can that number be used for, and only and only with regard to safeguarding the person's life and safety in that moment is the number ever disclosed. Otherwise, absolutely no need.
Safe.
And when it comes to, say, do I need to give demographic details? Of course, it's preferable because tomorrow you may again want to reach out to the service. You may have told so many things regarding your care, and if the next person also has to provide you with the same care, it may help for having a continuity of care. That's the only purpose of storing this information.
Getting those data.
Yes.
Awesome. That's great to hear. I'm interested because it's very important as public, because healthcare is used only usually when I'm sick, when I'm ill. Doctors, of course, are seen as the right person, and sometimes it's very important that public gets information and know their rights, know their
Absolutely.
what can be done, what shouldn't be done. And it's crucial, and it shows the quality of services, and it builds more trust into it. So thank you so much for detailing it. You mentioned earlier that Tele-MANAS is integrated in Army. Is there other services where Tele-MANAS is integrated,
So
or
currently we're
sectors?
Yes, so there are currently we're looking at intersectoral coordination. So one thing was Kiran, wherein the Kiran helpline was
Here
merged
in
into,
helpline, yes.
yeah, it was merged into, it doesn't exist anymore. So all those
Anymore,
calls
yes.
come to Tele-MANAS now.
Mm.
Similarly, the psychosocial support helpline that I mentioned to you earlier regarding disasters, it was very much
Mm.
functional, but now it has been absorbed into Tele-MANAS. So
Yeah.
for disaster mental health, also we have protocols in place as to what to do when there's a natural disaster. We have a tech feasibility of shifting calls, or if a cell is inundated or for any physical reason the counselors can't be there, how to take care of that state during the time of
Yes.
disasters, that's also taken care of. We have ongoing integrations at the state level and national level, with the police, with say transgender helplines, with de-addiction help. These are all ongoing right now and hopefully will be done soon.
Yeah, it makes a difference. Public sometimes is confused with all those changes, numbers, whom to call. Definitely, it's a big country, and every state will have its own resources on local level, but definitely national level resources are absolutely very important, because those are more coordinated, and the reach is much larger and so on. So it's good to hear that multiple call centers that serves to multiple target group for different purposes are sort of integrated together with Tele-MANAS to provide more support to it. That's great to hear. In the same line, what I see in my work, and we usually work mainly corporates, private corporates, we see that there is a need for access to care. And we all agree on that. And of course, corporates have roped in or brought in counsel therapists, sometimes third parties called EAPs and services. But yet again, despite being the same, like maybe an app or maybe a call that should be confidential, we see that the access is still low. We know well that the prevalence is somewhere 1 in 7 experience a mental health problem in our country. And at workplace, data says 1 in 2, but the reach out for access to care is still low on that end. And of course, it costs. It costs to could Tele-MANAS, or is Tele-MANAS tested in a workplace scenario, in a context like corporate?
So
I don't know the army. I apologize. I see definitely those are government streamlined
Yes,
sectors. How
yes,
about
yes.
private sector or
So
other
it
sector?
is, yes. So with regard to, so we've had some, some awareness activities for some of the corporates
Mm,
in Bangalore as well. And they have sensitized their workers regarding, workplace mental health. There exists, we've gone to many panel discussions also and the like of,
mm,
of having Tele-MANAS as one of the resource options. One thing I think it boils down to is the fact that it's a government service and how amenable people are to take help from it. That said, I think the people we do get a proportion of calls. I wouldn't
mm.
say it's a very high number, but the stress is still one of the top three reasons
The
why people
top.
are calling Tele-MANAS. And when we
Mm,
look more granularly at that stress, workplace stress
mm,
is a major chunk of that stress as well. So
mm,
there are individuals, it may not be as organized, like you said, as the government sectors where people are reaching out and we can trail each one of those. But we are
mm.
absolutely willing. Now, the problem with what I see, anticipate is the private sector is very, it's not just one domain. There are multiple
Yeah,
such
market.
domains. But
Sure.
yes, and Telemanas would be absolutely, we would be happy to collaborate. We'd be happy to explore how we can, provide services. It could be, if Telemanas could be that resource for
Mm.
their mental health, that's something which can definitely be explored.
That
So
would be
the
that would
ultimate,
be
I
great.
think, yeah, it would boil down to these sectoral coordinations, both horizontal and vertical, and ensuring that this actually happens. I think that's when we'd see a difference.
Yes, that's great. So the way how I see telemanas is that bridge that is so important to reaching out for support. And I think in this journey, people are as well getting used to seeking help. It's fine because when telling to them that go to the counselor, go to therapist, it's such a big reluctancy and doubt, or sometimes feeling offended. I'm not ill, and so on. So that stigma, misunderstanding, misconception, is sort of telemanas is helping through being online and assuring that quality, that it's okay to reach out and it's better to reach out rather than sitting and being in this situation. So I really applaud the work Telemanas is doing, and I really think that this is a great experience building for furthermore achievement ahead. What I'd like to I think we are almost at the end, and thank you so much for being patient and detailing for us everything that I'm asking. It's a great information. We mentioned it a bit early. We mentioned a bit early that under India is working, Indian government is working a lot towards achieving the universal health care.
Mm.
And Ayushman Bharat scheme 2018 and all the Ayushman Arogya and any other scheme that is under it is aiming finally to reach the SDG goal 3.10 target 3.8
Yes.
by
Mm.
2030,
Mm.
that
Mm.
every citizen in India have a universe access to care. Bit challenging, and this is not only for India, this is across the world. And I do all the time repeat when we speak in the train, oh, but this is India. I'm like, okay, we need to rethink this sentence, because across the world mental health access to healthcare is a challenge for any government. But we see that there are serious efforts in reaching universal healthcare. How is Telemanas playing a role in contributing to this journey that government is investing to?
I think, and with regard to, I think the structure, it really boils down to how I would like to laud the structure. I've been working in it, but seriously, I think both from a national and international perspective, and we
Mm,
have done our homework also to see how, say, 911 works or how these
yeah.
very proficient helplines in the West as well work. And maybe just the fact that there has been so much investment of time, effort into the structure to
Mhm,
ensure that there is representation, there is
mhm,
access. How does access, what does access with regard to a telemental health service really mean?
mhm,
Does it mean access to counselors? does it mean access to mental health professionals? And I think Tele-MANAS has been unique in that it may be one of the only helplines where you have access to counselors, but also specialists.
Professionals, yeah.
Like a country where you can reach a specialist, say, in like 5 minutes over a
Mhm.
telephone conversation. It may be one of the only places in the world where that's possible, free
Mhm.
of cost.
Mhm.
Um, I think with regard to universal care, two things I'd like to highlight here. One
Mhm.
is that how do we reach people who can't be reached with the
Yeah.
conventional resources? So, conventional resources in that we've done our awareness activities, we've told people about Tele-MANAS, they don't have a phone. How do we reach them? There's only
Yeah.
one phone in the entire household that is usually with the man of the house. He goes to work. How does the woman call? So that's
Mm.
where the role of these primary health centers, the Ayushman Arogya Mandirs really come in. And
Yes.
how Tele-MANAS has to and is it's already linked, but it will be it's a
Integrate
work in
together.
progress to link it fully all together.
Mm.
In that there are Tele-MANAS informational boards in each of these Ayushman
Everywhere.
Arogya Mandirs, which in
Mhm.
itself has been instrumental in increasing the number of rural calls. Surprisingly, Tele-MANAS has more rural calls than urban calls.
Interesting.
That was an interesting finding for us. And also, you needn't call Tele-MANAS only for yourself. So
Mhm.
you can reach out to Tele-MANAS as a caregiver. You can reach out to Tele-MANAS for someone you don't even know, somebody you may
Yes.
find on the street, because
Mm.
we can then liaise with those emergency care providers. We can liaise with the police if required to get this person help. The
Mm.
third thing is how Ayushman Arogya Mandirs can be that conduit. So ASHA workers, our
Yes.
grassroots level workers, being
Mm.
sensitized about Tele-MANAS or spreading the word about Tele-MANAS is really where I've seen the difference. So this is happening in some of these states across India where ASHA workers as a mandate are informing door to door about
Yes.
Tele-MANAS. And where
Mm.
they don't have a phone, the ASHA worker calls on
Girls,
behalf of
yes.
that individual who's distressed. So
Yes.
sometimes we'll have like 100 calls from ASHA worker
From the same
phone
number.
number. Yes, from the same number. And we
Who
know
is the
that it's
leader
a
of
it's a community
community?
health worker. Yes.
Yeah.
So the role of community health workers, because India's what I've realized with this program, it's just unique. It's unique, it's
Absolutely.
diverse. We provide mental health counseling and all these services in 20 languages. Even
Yes.
20 languages falls short because the dialect changes from district to district.
Yes.
So, ensuring that you've hired the counselors who speak local dialects. This has especially been true in the northeast region of India, where
Yeah.
the teams,
Tribal
care
areas.
teams have been very inclusive, informing or educating the ASHA workers, having sensitization programs for that, having sensitization programs for the local police, telling them that, okay, you can reach out in case you have a
Yes,
doubt.
in case.
Another
Yeah.
thing which is happening is, sensitization for ambulance workers.
Mm.
They may sometimes, even now, like when I am practicing in the emergency, I get a call about, ma'am, is the patient violent? So I
Mm.
always ask them, why do you ask that? Are you not going to get them if they're violent? So, so there is still a stigma, a sort of fear in reaching out or really helping somebody. There is an internalized stigma even among health professionals, I'd say.
Absolutely. Absolutely.
Yes. So
Absolutely.
I think it's a work in progress. We are
It
really
is.
willing to put in the effort it takes and see it through this effort. Yeah. That we're
It is,
hoping to.
it is amazing work, and the entire network of investment of mental health, either care, services, professionals, or community leaders, are important to become part of it. Else, it cannot be done by just one intervention alone. So that's amazing to see the integration, the communication across. And interesting that you're saying that rural areas calls more than urban areas. Yes, access to services, to public healthcare is, though might be more scattered in rural, is definitely people reach more. As
Yes.
accessibility
Mm.
and finances definitely limit people to reach out to private, definitely. But that's what we are working as Mental Health First Aid India training. They are called mental health first aiders in urban area, while they're called ashas in communities in more rural areas. And we know definitely there are ashas, but community empowered,
Mm.
public empowered with knowledge on mental health, how to recognize signs and symptoms, is absolutely very powerful to start closing that gap and reaching out to either Tele-MANAS or any service that is absolutely accessible. So that's great work. And let me do my last question to you. From 22, so I thought from 22, but it is from 20 and 21, where as NIMHANS, you are providing psychosocial support to people. And from there, the lesson learned, build it, Tele-MANAS. Now, where is Tele-MANAS going? Since 22, I'm sure you have learned your own lessons. So what's the future plan of Tele-MANAS?
So the future plans for I think we are in this tech revolution of sorts where
Yeah.
the world is also changing very, very rapidly. Tele-MANAS has to grow with those changes as well. I think some of those changes have been very instrumental, very useful across the world. One thing is to establish digital linkages. So that's something we're working on. Establishing this channel that I told you that we
Yes.
have between health
The
professionals
follow
across India.
system. The
Having, yes,
referral and follow-up system.
having a digital format of that is something which is in the books, and maybe even building on the chat, making it more accessible, more inclusive, more within reach. Using maybe exploring a collaboration with institutes of repute for use of artificial intelligence, but not with regard to service provision, maybe more
Yeah.
with regard to, say, training or using AI
Education.
models to help, build our counselor skills. That's where I said we have to also grow with what's happening. Many a times we see, comments saying, "Hey, my AI bot can do this." So but while also being very, very certain about what our what we can and cannot do as per the law. I think that
Yes.
becomes that's very black and white with regard to tech. We have to be very, very clear about that. Resource mapping is another thing which is coming up in a big way, which we are undertaking in phases, and it's really growing. It'll take a long time to map the resources of India fully, the health resources, but that's being undertaken very systematically. So that's something which will happen in the long run. We also hope that we can have, like, can you track your appointments? Can it really be at your fingertips? Can it
Reminders.
be part of the app? So these are
Yeah.
all maybe the future directions that we're looking at, and we're
Oh,
also looking forward to more collaborations. These intersectoral, not just within mental health, but outside mental health, with law enforcement, with
yes.
policymakers,
Yeah.
open the dialogue of Tele-MANAS at a national and international level. So that's something which has been
That's
ongoing, but
amazing.
we plan to build it up more as well.
Amazing, amazing plans. Definitely, there's nothing better than the organic growth. You learn from what you're doing today, and that teaches you what is the need and how, because that's the most sustainable one.
Yes,
That's
ma'am.
at least what my experience has taught me. But yeah, I've definitely there are questions around Telemanas. We can talk more and more. I'm confident about it, but we will need to close it here. And I'd like to really thank you sincerely for your time,
Thank you.
your
Thank you, Karen.
detailed information on Telemanas. I'm sure I'm confident Dr. Naveen left us with in safe hands with Dr. Swati. So we got what we the mission of this session was about all about Telemanas. And so public get informed, well informed, and know more. And more people knows, the better it is, that's for sure.
Ma'am,
So
if
the
I have,
yes,
if I may just add
yes,
two instances of
please,
how, like, I just off the top of my head, in which Tele-MANAS has helped. Like,
yes,
if
please.
proof is through these stories that we call
Yes.
success stories, but stories of hope, in a sense, where how Tele-MANAS has been able to help individuals. So one that I remember is an individual who was very much, when ma'am mentioned about villages, that's how it struck me. That this person who was ostracized from his village, they were actually living outside,
Outside.
and they had no means to access even basics, resources, because they were ostracized. And this was because of mental health issues which ran in the family.
Mm.
uh, Surprisingly, one of the family members called Tele-MANAS, one of the three people who were afflicted at the time. And Tele-MANAS was able to, tell them about what they may be going through, how they can be helped. We were able to liaise with DMHP. DMHP made home visits. We kept in touch with them. I'm talking about months and months of being in touch with them.
Yes.
And maybe after 7 months, we finally broke through and got like the DMHP team was also able to sensitize and educate the leader of the village about why this has happened. These people, two of the family members recovered in the meantime. The third with a physical disability was helped in the meantime through this license. There was a disability certification which could be facilitated. They started getting money, and this person was finally brought back into living within the community. So I
Wow.
think that was something which was, which really told us, ki, okay, this is the scope of this, can be the scope of this service. There were
Yes.
multiple instances of people who were acutely suicidal who were reaching out to us, and Tele-MANAS has liaised with the team there. The state team has managed to liaise with the parent, with the person who is in charge of where this person stays, since they were not staying with family, ensuring their immediate safety,
Was
coordinating with the
good. Yeah.
police, and ensuring that this person actually comes to the hospital the next day. So this is an ongoing task. There have been several such instances. Somebody
Several,
physically
multiple, I
feeling,
believe.
yeah, multiple such
I,
instances which have happened.
Multiple. I believe that I personally, in my start of my career, I was part of multidisciplinary team in mental health because can't be only one profession. And I
Yes,
understand the power of network, the needs
absolutely.
of a person. In the first case that you was not just about mental health, was about acceptance, was about access to livelihood, access to their own house, and being
Really?
part of the community. So it's not just, while it comes across as mental health concern, and that is valid and need to be addressed, there are multiple things that mental health concern would have sort of impacted or so on. And I can truly believe you in that. I mean, we can't go in detail today, but I know that one call at Tele-MANAS is another story altogether, rather than just another call in that log book that you have put there. It's another story of another life, and more than that,
Absolutely.
one life being impacted, being helped, supported. And that's what citizens need today: access to care, feeling supported, feeling that somebody cares for them and really matters, and their problems are sorted. So thank you for Dr. Swati for bringing, illustrating in this way. It's very, very, very crucial and important to understand the impact of it. So to everybody who is listening, I really thank you for coming, for being here, or wherever you are listening. This video is running in YouTube live and will be there. So anytime you can watch. Um, Save the number. I mean, Tele-MANAS is a very important access right now, and definitely will become much more important than it is right now with their own, with the entire technology or initiatives that are across. So save the number, keep it accessing for yourself. We need to acknowledge that all of us, none is safe. We all can experience mental health problem. Have that number handy for yourself, for people around you, your loved one, or someone that you meet that needs help. Have that number saved, whether you can download the app or you can see in the website. We have Tele-MANAS number in our information, MHFA and everywhere, where we say, please keep this number as immediate response. Thank you so much for being with us. I hope this session has been useful, informative to you and helpful further on. I'd like again to thank you, Dr. Swati. Thank you so much for being detailed on that. Congratulations on the work that you all are doing as team, to Dr. Naveen, to you, to all the counselor and the network that stands behind Tele-MANAS as absolutely a game changer when it comes to access to mental health in our country, in India. So thank you so much. And
Thank
until
you.
we meet for the live session next one, stay well and happy festivals. It's a time of festivals. So everybody's looking forward to stay positively happy. But nevertheless, access someone or talk to someone when you need help or care. And Tele-MANAS is always there. Dr. Swati, thank you. Have a great evening. Thank you so
Thank
much.
you, ma'am. Thank you so much. Thank you for having me. Thank you all.
Stay